let's discuss the definition of health. Sometimes some people say that absence of disease is health. No. WHO says it is a state. It is a state of complete physical, mental. It is very important aspect of health, mental health, social well-being. Person should be socially healthy. Not merely the absence of disease. Absence of disease is not health. All these elements should be present. And infirmity or disability. A person is said to be healthy if all these three dimensions are present. He is mentally healthy, he is socially healthy, he is physically healthy. Let's discuss the dimensions one by one. Number one, physical dimension. When you say a person is physically healthy, if he is performing his activities, if his body is functioning, if he is moving, if he is running, so he is functioning normally. When you say a person is mentally healthy, absence of mental disease is not about mentally healthy. We must see the interaction, or we can say that how he reacts to situations. If a person reacts normally, he is mentally healthy. What is his reaction in anger? What is his reaction in fear? What is his reaction in happiness? And then social dimension, social environment, surrounding environment, his interactions. In a daily life, we interact with certain people. A person may interact with his family members. How is his interaction with the family? He may interact with his neighbors. His interaction in his working environment. They all affect our health. If his interaction with his colleagues is not normal, he may develop stress. If his interaction in home with family members is not normal, he may develop stress. So all these elements contribute towards comprehensive health of individual. Complete physical, he is functioning normally. Complete mental, he is acting normally, his actions are normal, he is reacting normally. Social well-being, his interactions, it is not merely the absence of disease and infirmity. So now we'll discuss natural history of disease. What is natural history? It's a process of disease progression. We'll see how the disease progresses. In the absence of any treatment, no treatment is given. Or we can say that it is the unfolding of disease process without any intervention. No intervention is done. We just see how disease progresses. Our disease process starts with the invasion of risk factor. Risk factor brings certain changes in the body. Certain signs and symptoms appear. It may progress to later stages. It may recover. It may cause death or disability. So let's discuss them. We can see there are two phases, pre-pathogenesis and pathogenesis. What is pre-pathogenesis? Agent or risk is present. Host is present. And there is certain environment, but they are not interacting with each other. This is pre-pathogenesis. When they start interaction, they may produce a disease. How? Pathogenesis phase starts after the completion of incubation period. What is incubation period? It is a time period between the invasion of organism till the appearance of first signs and symptoms. Or organism invades, it provides signs and symptoms after some time. This time is incubation period. after manifestation or invasion, early symptoms appear. Early symptoms appear in the host. Then, if we let the process to progress, there may be later symptoms, maybe later pathogenesis, the late pathogenesis. And this pathogenesis, what can it cause? One may recover, but if it progresses, illness can cause disability. Disability can